जिंदगी का एक महत्वपूर्ण हिस्सा बन गया है। अब आप ही देखिए कि आप अपने मोबाइल फोन के बिना कहीं रहते हैं? नहीं, हर किसी को अपना लैपटॉप अपनी आंखों के सामने चाहिए और घंटों घंटों हम बस उसी के सामने बैठे रहते हैं। लेकिन आगे चलकर ये एक बीमारी भी बन सकता है और इस पर चर्चा करने के लिए हमारे साथ बोरीवली वेस्ट मुंबई से जुड़ रहे हैं डॉक्टर धवल हरिया, जो कि एक आई स्पेशलिस्ट है, कई सालों से प्रैक्टिस कर रहे हैं। और डायरेक्टर है आई एंड आई हॉस्पिटल के, जिनसे आज हम चर्चा करेंगे कंप्यूटर विजन सिंड्रोम पे। सबसे पहले स्वागत करते हैं उनका। डॉक्टर धवल, वी वेलकम यू टू GMoney हेल्थ शो।
थैंक यू। हाय।
एंड जैसे कि मैंने आज शो की शुरुआत में बोला कि कंप्यूटर के बिना हमारी जिंदगी है ही नहीं तो हम सबसे पहले आपसे जानना चाहते हैं, हमारे जो हजारों लाखों व्यूअर्स आपको देख रहे हैं, आप ये बताइए कि कंप्यूटर विजन सिंड्रोम क्या होता है?
So computer vision syndrome is nothing. Basically, it's just the strain secondary to the excessive screen time which your eyes goes through. The symptoms which you develop secondary to that is collectively called as computer vision syndrome. So as you discussed already, post-pandemic, overall screen time has gone significantly high. And it's through across all age groups. It's gone high significantly in the pediatric age group and as well as in adults. Secondary to multiple factors. Now, when you are in front of screen for such long hours, for such excessive hours every day, and that screen can be in any form. It can be your computer, it can be your laptop, it can be your tablet, it can be your phone, it can be your television, anything. The more number of hours you spend in front of screen, you end up straining your eyes that much more, and the symptom which you develop secondary to that is collectively called as computer vision syndrome.
Okay, and आपने एक बड़ी अच्छी बात बोली that yes, it's absolutely true कि पेंडेमिक के बाद वो वर्क फ्रॉम होम कल्चर से कहीं ना कहीं अब हम बस अपने सिस्टम के आगे बैठे हुए हैं। सो यस, उससे कंप्यूटर विजन सिंड्रोम हो सकता है। अच्छा डॉक्टर धवल, ये बताइए कि ऑफ कोर्स बीमारी छोटी हो या बड़ी हो, लक्षण होते हैं, तो इसके सिम्टम्स क्या हैं?
Okay, so the most common symptoms which you get is tiredness, fatigue, little bit of dryness, secondary to continuous staring at the screen, little bit of irritation in your eye. Most commonly, symptoms of eye strain basically is what you get. It can also cause sometimes because of excessive strain, some amount of blurring of vision, sometimes some form of double vision. So all these things are collectively which you go through secondary to strain.
ओके, सो विजन पर भी प्रभाव पड़ सकता है अगर कंप्यूटर विजन सिंड्रोम के हम शिकार हैं, तो जो कि मुझे लगता है अमूमन हम सभी हैं आजकल, बिकॉज अगेन हमारी जिंदगी का एक महत्वपूर्ण हिस्सा है। अच्छा, एक और चीज सर, ऑफ कोर्स जब से अब कंप्यूटर्स हमारी लाइफ में आए हैं तब से ये चीजें स्टार्ट हुई हैं। सो आप अगर ये बताएं कि अब अगर किसी का वर्क ऐसा है कि वो डिमांड करता है कि उन्हें अपने सिस्टम के आगे बैठे रहना है, तो क्या ये चीज है ना वो एक परमानेंट हो जाती है या बस एक ये टेम्पररी सिम्टम है जो हम फेस करते हैं, या ये परमानेंसी भी डेवलप करता है?
No, it is not something which is going to remain permanent. It is slightly dynamic in the sense the number of days or a period during which your screen time is going to be excessive. You're going to suffer them more compared to the days when you're not going to have so much of screen time. Your eyes will get, your eye muscles will get that much relaxation, and you'll not feel the symptoms as much. So it's not something which is permanent, but it's something which can definitely bother you when you have going through it, and when you are having significant screen hours on a
day-to-day basis. Yeah. Okay. Yes. And डॉक्टर धवल, अगेन एक सवाल जो मेरे मन में आया वो ये कि अब हमने बड़ों की तो बात कर ली कि वो सिस्टम के आगे वर्क फ्रॉम होम है, छोटे बच्चों की बात करते हैं, बिकॉज पिछले 2 सालों में स्कूलिंग भी, हमारी जो लर्निंग है, जो स्कूल है, क्लासेस हैं, वो भी सिस्टम के आगे ही है, लैपटॉप है, टैबलेट है, मोबाइल फोन में बच्चों का भी स्क्रीन टाइम बहुत बढ़ गया है। तो आप हमारे प्लेटफॉर्म के जरिए पेरेंट्स को क्या कहना चाहते हैं कि कैसे अब बच्चों की जिंदगी में भी कंप्यूटर्स हैं या सिस्टम है, तो कैसे वो कंप्यूटर विजन सिंड्रोम होने से बच्चों को हम रोक सकते हैं?
So to begin with, first of all, get one. It's especially if your child is around 5 years, that's the best time to get first eye checkup done. So approximately first eye checkup around the age of 5, and after that on a regular basis. Regular basis in the sense, what we recommend is around yearly. One routine eye checkup. So if at all they have any form of glass numbers, any form of refractive errors, कोई भी चश्मे के numbers है, that can be corrected.
Diagnose हो जाता है.
Yeah, that can be corrected. And any form of so secondary. So if you have glasses and you're not wearing, and you are having excessive screen time, that's gonna strain your eyes even more. So it's better to get that checked. If you have a number, get your glasses done and start wearing your glasses. That's the first point. Second point, make sure the screen time is not continuous. Try to break it down. It should not be that your kid is in front of screen continuously. It's always important to give your eye muscles break in between your screen time. So cut it down. Like make sure that they're not watching a show or a cartoon or whatever for like continuous for long hours. That's it. Similar thing goes on for adults as well. I'll come to the adult part later.
Okay. एंड सर आपने हमें ये भी बताया कि विजन पे भी फर्क पड़ता है और ये सारी चीजें हैं. अब हम बात करते हैं ट्रीटमेंट की. सो फॉर एग्जांपल अगर आपके पास कोई आता है जिसको आप कंप्यूटर विजन सिंड्रोम बोल रहे हैं, इसे सुनने में बहुत बड़ा नहीं लग रहा है, लेकिन आई एम श्योर जिस हिसाब से आपने बताया ये बड़ा रूप भी ले सकता है. हाउ डू यू फिक्स दिस? आई ड्रॉप्स आप देते हैं, आई एक्सरसाइजेस बताते हैं, क्या बताते हैं?
So whenever, especially, so let's talk about 30-35-year-old adult who walks into the clinic with significant hours per every day in front of screen and who is suffering through the symptoms mentioned earlier. The first thing will be to get their eye power checked. If they have any form of glass number, that should be corrected first. So if there is a small number, अगर छोटा सा भी glass number है and they are not wearing glasses, better you start glasses so that at least the strain secondary to the number comes down. That's point number one. Number two, what I was telling you about was to break down your screen hours. It should not be that if you say your work demands you to be in front of screen for 7-8 hours, 9 hours a day, make sure you're taking adequate breaks in between. What we recommend ideally is something called as 20-20-20 rule.
20-20-20 rule. Okay, and what's that, sir?
So that basically means every 20 minutes you stop looking at the screen for 20 seconds, and for those 20 seconds you look at something which is far away. So we say something which is 20 feet away, something outside the window. So every 20 minutes at 20 feet for 20 seconds. When you do this, all your eye muscles which are getting used when you're doing near work, when you're looking at your screen, staring at your screen, they get adequate time to relax. So when you're looking far away, those muscles get time to relax. That eventually, if you keep doing this throughout the day, the strain on your eye muscles eventually at the end of the day becomes significantly lesser. So symptoms of eye strain, fatigue comes down drastically. First thing, what I discussed was about checking your glass numbers. Second thing is breaking down your screen time. Coming to the third point is, whenever you are in front of screen for such long hours, you should remind yourself consciously to blink. The more you blink, the healthier it is.
Right.
So your resting blink rate when you are at rest, when you are not in front of screen, is approximately 13 to 15 times a minute. But when you are working on screen, when you're concentrating, you're focusing on a screen, because your entire attention is on screen, your blink rate goes down. From 13 to 15, it comes down to somewhere around 5 to 7 a minute. Now this reduced blink rate causes small dry spots on the surface of your eye, which eventually gives eye strain, symptoms of that irritation, some burning, specific itching, and it causes strain on your eye. So make sure consciously whenever you're in front of screen, you blink. The more you blink, the healthier it is. Last thing is we usually prescribe lubricating eye drops. Those are to be used around 3 to 4 times a day.
And they are safe, sir? They can be like used without a doctor's consultation?
They are usually safe. Ideally, if you need it or no, let the doctor decide. And if the doctor feels you need them, it's better to use them around 3 to 4 times a day. Okay. Those also kind of improves the lubrication on the surface, so the strain secondary to those dry spots, irregular lubrication gets better. So these are the 4 main and most important things. Make sure you're using the correct glass number. Make sure you're taking regular breaks. Make sure you're blinking adequately, and if required, you're using the lubricating eye drops. So these are the 4 important things. Yes.
So absolutely.
There are few.
हाँ जी बताइए.
There are few other things as well which helps. Now, one of the thing is that when you're sitting in front of these are not like direct treatment as such, but these are just the workplace modifications which, if you do, will definitely help in reducing the strain on your eye. Now, one of the important factors is when you're sitting in front of screen, most of the time you must be sitting in an air-conditioned room.
Yeah.
Make sure the direction of the wind is not coming directly on your face. Direction of the blast, basically. When you have a direct blast which is hitting your face, it causes again surface dryness. It causes tear film to evaporate quickly, and that causes dryness, which eventually adds on to the strain. So make sure that's not there. No form of direct blast should be coming on your face. There should not be any form of light behind you. So when you're sitting in front of a screen, and if there is a light behind you which is getting reflected from the screen, that also adds on to the strain. Make sure that you adjust your screen in a way that there's no indirect reflection of the light which is coming from your screen. That also adds on to the strain.
So yes, आज के शो के हमारे इम्पोर्टेंट जो टेकअवेज थे वो ये कि हमें पलक झपकाना बहुत जरूरी है. तो अगर आप नॉन स्टॉप स्क्रीन पर हैं तो यस, डू नॉट फॉरगेट टू ब्लिंक योर आई. और जैसे डॉक्टर धवल ने बताया 20-20-20 रूल, यस 20 सेकंड्स के लिए आपको देखना है इधर, व्हिच इज अगेन मतलब बहुत ही अच्छी ये हमें टिप्स उन्होंने आज दिए हैं जो मुझे भी नहीं पता थे. और डायरेक्ट आंखों पर हवा भी नहीं लगनी चाहिए, लाइट नहीं लगनी चाहिए. मतलब ये वर्क प्लेस छोटी छोटी चीजें हैं जिनको फॉलो करके यस हम कंप्यूटर विजन सिंड्रोम से बच सकते हैं. एंड ऑन दैट नोट डॉक्टर धवल, हम आपको थैंक यू कहना चाहते हैं पूरी जी मनी टीम की तरफ से कि आपने अपने बिजी स्केड्यूल से कीमती वक्त निकाला और आप शो पर आए. थैंक यू सो मच.
थैंक यू. थैंक्स.
तो ये थे डॉक्टर धवल जिन्होंने आज हमें बताया कंप्यूटर विजन सिंड्रोम के बारे में. आपको आज का वीडियो कैसा लगा हमें जरूर बताइएगा. इंस्टाग्राम पर आप हमें मैसेज कर सकते हैं या फिर कमेंट बॉक्स में टाइप करके भी बता सकते हैं. एंड ऑल्सो जी मनी के यूट्यूब पेज को सब्सक्राइब करना ना भूलें. डू हिट द बेल आइकन. तो ऑन दैट नोट मैं नेहा बजाज आपसे लेती हूँ इजाजत. मिलेंगे आपसे जी मनी हेल्थ शो के एक नए वीडियो में विद अ न्यू सुपर स्पेशलिस्ट एंड मेडिकल एक्सपर्ट. टिल देन कीप वॉचिंग जी मनी हेल्थ शो, क्योंकि अच्छी सेहत हमारा वादा. बाय.